Chris, how are you doing today?
Good.
I'm Dr. Wright. I'm a prosthodontist in the area, and usually what I do is I interview my patients prior to coming in, and exactly what brought you in today.
My TMJ.
TMJ. So, are you aware of what TMJ is? Have you heard of the terminology, and have you sought treatment elsewhere?
Yes. I've been seeking treatment for several years. I know what the technical name is for, but it's basically the grinding of teeth and the clenching of the jaw.
Okay.
And I've experienced it for, developing degrees for over 10 years now.
Okay. Now, my area of specialties is that I'm a prosthodontist. I deal with full mouth reconstruction. I deal with quite a few injuries, traumatic injuries, reconstruction. I'm very familiar with occlusion and some of the causes of TMJ and how it's being actively treated. Can you describe your pain to me?
It's neck pain, jaw pain, stiffness, and soreness of the jaw.
Okay. And have you seen anyone prior? You mentioned that you were seeing other providers. Has that been successful for you?
I've seen several different dentists, and to varying degrees. They've had some semblance of success, but it's only been temporary. I think the only thing right now that mitigates some of the pain is the night guard that I wear.
Okay.
And then when I have bouts of, where it flares up, I have to use muscle relaxants.
Okay. Yeah, you can actually use anti-inflammatories in conjunction with it, depending on the severity of the case. I was reading through your history, and as most of my patients are, they usually have a history of some sort of trauma, whether it was childhood, congenital deformities of the jaw, or their disc. In your case, you're an NFL player.
Mm-hmm.
Could you elaborate on that for me?
Well, I guess the issues with the TMJ started when I was in high school. I've been playing football since I was 8 years old. And as I progressed through college and the NFL, it got progressively worse. And it's funny because I noticed the thickness of the mouth guard that I wore went from like a thin piece of plastic to hard acrylic that's almost a ½ inch thick now. So as I progressed with the disease, the treatments have of varying degrees stayed the same, but I've had nothing that has come across that really alleviates the pain.
One of the things that I'm doing to promote my mouth guard, the right guard, is I'm working on current players, and for a lot of players it's just a piece of plastic.
Mm-hmm.
And I'm trying to make them more informed of how that piece of plastic can make a tremendous impact on their life. I'm currently involved with trying to get some of the current players to speak out, to tell their players that, hey, this isn't mandatory, but let's push to wear it, because these are some of the things that can result from it.
Yeah, I definitely feel that in today's game, with the players being bigger, faster, stronger, the contact being more violent, that anything that you can do to prevent head trauma is a step in the right direction. And with what I've seen, how you do your treatment with the mouth guard, the attention to detail that you have with the mouth guard, I think it definitely is something that could help professional football players, with both college and high school, even Pee Wee League players. The sooner you start, the easier it is to prevent something bad happening. And with concussions these days, it's a step in the right direction.
Absolutely. I read an interesting statistic the other day. It was this past season, concussion rates went up 21%. So those are the things that we see. And you can imagine from my field some of the things that a lot of attention has been brought up to,
Mm-hmm.
which is breaking the teeth, clenching, jaw pain, disc rupture. And what you'll see in a few moments is we actually do a very thorough examination. We palpate the muscles. We listen to the joints. We actually put you on a machine that does a 3D animation of the way your jaw moves prior to fabricating anything else, because the last thing we want to do is fabricate a mouth guard or a splint with these built-in abnormalities, which can cause the problems to even become greater.
And one of the reasons why I decided to come to you, Dr. Wright, was that most of the dentists that I had gone to in previous attempts to figure this problem out took a general approach, and you were the only one that really takes an individualized approach to really healing the problem, and that's what I need. So,
well, I appreciate you coming in, and as you see in a few moments, the process can be very wouldn't say time consuming, but overwhelming, we'll say.
Well, I'm looking forward to it.
All right.